Hi, my name is Victoria Okine, and this is the presentation over sedatives and hypnotics. I'm going to be discussing the short-term and long-term effects, side effects, and preventing dependency. So, sedatives and hypnotics are known to be antidepressants, and that means that they slow brain activity because they block the neurotransmitter to serotonin, and this results in slow brain activity and can have these effects: drowsiness, slurred speech, poor concentration, confusion, dizziness, problems with movement and memory, lowered blood pressure, slowed breathing, and for disorders like insomnia, it can treat that with short-term doses. Okay. Some long-term effects. So sedatives are high, they have a high dependency, and if you use it for long-term usage, then you would have to take it at a higher dosage and more frequently to get the normal therapeutic effects that you would taking at the required dosage. And that makes it highly addictive. Continued long-term usage of sedatives can also lead to dependency and withdrawal issues if you reduce or just completely stop. This would cause the rebound effect because the brain slows down its activity when you use these type of antidepressants. So if you just reduce it or stop, your brain tries to function and regain its normal pattern and wavelength, and this, in a worst case scenario, can cause seizures. Okay, side effects. In older adults, overusage can lead to risk for falls, fractures, and bone loss. In pregnant women, it can result in a short-term withdrawal period in newborns which means that they can have respiratory problems, slowed brain activity, or just delayed functions in general. In teens and adolescents, it can lead to increasing suicide rates. Short-term antidepressants can help teens and adolescents that have suicide tendencies, but if you take it long term, it can have a reverse effect and increase the suicide rates. People who have a bipolar disorder, they can get worse with antidepressants because of the depressing side effects, and this can also have a reverse effect. Preventing dependency. So to prevent yourself from becoming dependent on antidepressants, you should follow the instructions of the medication or the instructions given to you by your doctor or healthcare provider. Basically, if it says to take it one time a day at this dosage, then do exactly that. Don't overuse or abuse the antidepressant. Also, do not mix the medication with any other drug interactions. Don't take your sedative and hypnotic and then mix it with alcohol or mix it with another drug because this can bring out effects that aren't known because you're mixing it with something else, or it can make it highly addictive. Also, take note of any possible side effects. If it gives you heightened relief and more than it should be, then you should take note of that. Also, if it gives you headaches or um, uh, depressive thoughts or anything of the sort, then maybe that's not the antidepressant that you should be using. So you should also take note of that. Try therapy and natural ways of antidepressants. So basically, you can try talking to someone. You can try, and this is with insomnia, you can try rain sounds or soothing music to make you fall asleep. You can try taking B vitamins, zinc, and things of that sort to just basically prevent yourself from even getting into sedatives and hypnotics and preventing dependency all around by just not using it. So these were the short term, long term side effects and preventing dependency of sedatives and hypnotics. And here are my references. And thank you.